Discover KDH Collective's Leaning into Therapy podcast, an enlightening exploration of therapeutic approaches and evidence-based protocols. Join us as we delve into the vast landscape of therapeutic interventions, guided by the belief that collective intelligence surpasses individual expertise. Led by Katie Holmes, a licensed professional counselor with 16 years in private practice. This series offers valuable insights, expertise, and training from a team of skilled therapists. Prepare to immerse yourself in the world of therapy, created exclusively for therapists by therapists.
So we are doing another episode of Leaning into Therapy, and I'm Monet David, licensed professional counselor. And with me, I have John-Michael. John-Michael, introduce yourself and all your letters that come after your name.
My name is John-Michael Bellard. I am a board certified psychiatric mental health nurse practitioner here at KDH. So I do prescription management.
Exactly. And that is what we're talking about today. We're talking about medicine and one medicine in particular, or a class of medications. You're the expert, so I'll let you speak on that. But we were both kind of like, what is RFK doing? What is he talking about? Taking SSRIs away? Like that seems wackadoo. And so I was like, let's do a video together. Let's educate the people on why that is problematic. And I think just for like the average layperson who may be coming across this video, can you tell us what SSRIs are?
Yeah. So SSRI stands for selective serotonin reuptake inhibitor.
Okay.
It's widely known as an antidepressant medicine.
Okay.
We use it for depression, anxiety, and any type of mood disorders, pretty much.
Okay. Pretty common. I mean, everybody and their mom's on one if they're paying attention to what's going on in the world. Feels
Yes.
very medically necessary these days. So I think that's part of the reaction to that statement. With the understanding that headlines have to be sensational in order to get clicks, you know. But we know that the Make America Healthy Again initiative has been very critical of medications. It seemed they started with stimulants, now they're moving on to SSRIs. But tell me, as somebody who has studied medication, knows about it, um, are SSRIs healthy? Are they as to be feared or as to be removed from access as they're claiming they should be?
So I believe that SSRIs are very important. There has been a lot of research that goes on behind these medications. Of course, they have side effects just as every other medication does, but the risks outweigh the benefit.
Okay.
So the way I like to think about it is, in depression and mood disorders, you have this imbalance of neurotransmitters. So what these SSRIs do for you is to increase the effect or the amount of available serotonin, which is decreased in depression. And
Okay.
so by reuptaking and reusing that serotonin, it helps elevate your mood to get out of the depression. Without that SSRI, your body doesn't really know how to use that serotonin if you have that imbalance.
Okay. And so you're saying the risks of remaining unmedicated too great. There's too many benefits to be had by pursuing medication management. Um, what I hear from clients when I start talking about medication as the therapist, I can't prescribe, but I am a proponent of that, is, oh, I just don't know, like it's going to rob me of my personality, or I'm going to have really bad side effects. How do you meet people who are maybe reluctant, who are maybe hearing like, well, he's trying to take us off. He's trying to take everybody who's already on them off of them. How do you educate people? How do you reassure them that they can access this medication and it'll be okay?
Right. So, like we said, SSRIs are widely used. They've been around for a great number of years, and they have shown great promise in the reduction of depressive symptoms and sometimes even complete reduction. Um, However, I like to compare it to, let's say, high blood pressure.
Okay.
Your blood pressure is high, you get started on medicine to lower it.
Mm-hmm.
The reason why your blood pressure normalizes is because of that medication. If you were
Mm-hmm.
to get off of that medication, the risk of your blood pressure going back up is super high.
Mm-hmm.
Take this and transform it into mental health because
Mm-hmm.
your brain is an organ just like any other organ in your body.
That's a good
These
way.
medicines help to regulate that serotonin.
Mm-hmm.
Without that regulation, you can most likely will dip back down into those depressive stages and have those depressive symptoms. So, being that these medications are safe, they have done extensive studies on them. People are still on them today.
Mm-hmm.
I think it is super important to continue taking that medicine just as you would take a blood pressure medicine for your high blood pressure.
You're getting to my next question, which is, what if somebody reads that headline, they're being prescribed and there's this panic or like, I have to get off of them. What are the potential risks with just abruptly stopping an SSRI?
So, there is something called discontinuation syndrome
Hmm.
whenever you abruptly stop. So, this can cause serious, even life-threatening um, effects. You
Okay.
can end up in the hospital. You can see long-term effects from it. Whenever you get off of an SSRI, not under the supervision of your clinician, it can lead to this discontinuation syndrome.
Okay.
So, what I want to stress to people is if you are 100% certain that you absolutely cannot take it, you cannot just stop it cold
Mm-hmm.
turkey.
Mm-hmm.
It is a conversation to have with your clinician who is trained on these medicines, how to do it, and when to do it.
So it needs to be a collaborative effort, not just an independent sort of thing.
Right.
I also think about influences of finances. So it may be that they do want to stay on the medication. They are unable to access the medication. And to me, if that's being spoken to in a session, my immediate suggestion is talk to your provider. Let's look if there's a good RX coupon. Let's see if there's samples to be had. And if it is worst case scenario, maybe there's another a more affordable with their
Hmm.
insurance SSRI to switch to. And then last case scenario, let's start. Is it titration? Is that the right word?
Yeah.
Okay, so we start titrating down safely under their care. Would you be open to that if a patient came to you and said, like, I just don't want to be on this anymore? Um,
Right. I totally agree. I think that, your health is a collaborative
mhm,
conversation to have. Obviously, I can't force anyone to take medicine, but I
mhm.
can collaborate with them to determine, like, hey, I would want you to stay on this medicine. What are
Okay.
your thoughts on it?
Mhm, mhm.
Is this medicine too expensive for you? Is there a generic form of the medication that could be a lot cheaper?
Yes. Oh, and I love a good pharmaceutical coupon. Oh my goodness. Like
Hmm.
I'm a big fan of that. I didn't realize what that was. And now I'm telling clients like look into what's the like look into the manufacturing company and see if they don't have a program, which they typically do before the generics are introduced into the market. So sometimes there's like a really good deal to be had. Um, so not only is it that you arrive to the office, you are building rapport, but you're having to do a lot of education and a lot of like corrective, like no, that sensational soundbite isn't necessarily the whole or even the entire truth to things. So it's like you're on the front lines trying to get people the help they need, that they deserve, that they don't really need to be scared of. Um, and it's good work, it's rewarding work, but at the end of the day I think um people sometimes get caught up in, again, like the headlines of it all and that. So um do you have a recommendation? Are there, and I'm putting you on the spot right now, but Where do you get your information as a provider about stuff like this? Are there trusted resources where it's like if a person wants to do their research, you say, okay, try this website or try this magazine. Are there trusted sources for people to learn more about SSRIs?
Oh, absolutely.
Okay.
So I do my research through research articles, through
Okay.
different medical journals. There
Hmm.
are plenty of medical journals that are available. I would also recommend something like Google Scholar.
Yes.
With Google Scholar, you can filter out the results for, peer reviewed, which
Mhm.
are experts that actually review these articles and make sure the
Exactly.
information is correct.
Yeah.
So I get a majority of my research from those research articles. And
Hmm.
then as well as, you can go onto the actual manufacturer's website and look up the drug
Hmm.
and see all the information about that drug from the manufacturer itself.
They usually have a really good FAQ portion on a website to kind of like inform people of potential risks, side effects, all that kind of stuff, which is usually helpful. And it's in language that is very understandable. I love telling people about NAMI, so the National Alliance on Mental Illness, because they often have not only like therapeutic based information, but they also, I think, do speak to medication and how to, take medication responsibly, that kind of thing. I'm trying to think of any other organizations. Particularly, I feel like there are organizations for every type of mental illness. So
Hmm.
they're often going to have really good research around medication, but it just boils down to this medication has been studied. It's been proven effective for most. It's safe when taken as prescribed. Um, and I think clients, patients have the right to demand a collaborative approach. I think a
Hmm.
lot of times they get turned off because the provider is just really checked out and not wanting to be collaborative. So to that, I always say, find somebody else. We're very
Yeah.
spoiled because we have you and you're going to listen to them and you're going to educate them. So it's kind of this really great privilege that we have as clinicians here to be able to say, John-Michael's going to listen to you. He's not just going to write a script and kick you out of the office, which I have heard from people for other providers.
Hmm.
It's very evident in how you practice that you care, that clearly you're informed, clearly you see the whole person sitting in front of you. And so it's just really nice. When things like this come up in the headlines, I'm like, no, I've got the expert down the hallway and he's going to set you straight and he's going to make sure that you get the right combination of medication if it's more than one. Is there anything that you feel like we didn't touch on that you want people to know about SSRIs?
I think a big thing would be you can't take what one person says about the medicine that has been on it
Mm-hmm, mm-hmm.
and form your complete opinion based off of that.
It's so true.
Each person's body responds totally different to everything, and their opinion, as well as their, experience with it, the side effects that they had, whether it was beneficial or not, is individualized.
Mm-hmm.
Although, you know, in the research that they've done, the majority of people showed this response. There is always that other percentage of people that had a different response.
Yes.
So there's something out there for everyone.
I love to talk about two truths being like, yeah, they can be two truths existing at the same time, coexisting with one another. And so
Right.
it's not to invalidate your friend or loved one or whoever that it didn't work for them. It probably didn't work for them, but it doesn't mean it's not going to work for you, and vice
Correct.
versa. And yeah, that is such a good point. I really appreciate you saying that out loud because I do think I think it makes people feel like, well, is there really anything out there that's going to help me? It discourages them. That's the word I was thinking of. It's like very discouraging to hear, oh, that didn't work for me, sort of thing. And so yes, to keep that hope going. Okay, it could work for you. It couldn't. We are making strides with genetic testing, which really narrows down things for
Hmm.
people, which is always an option if they're really worried about, doing the trial and error thing and figuring out what works for them. But yes. I think that if anybody has been considering SSRIs, has been considering therapy, should absolutely check out our website, katieholmeslpc.com. It has all of our information on there. You get to know us, how we exist, how we collaborate together. And know that we see the whole human being in our practice. We want to hear what they have to say. We want them to be, team players in all of this. So I'm very happy to have you in our office. Thank you so much for taking time to talk to me today.
Of course, I'm always willing to talk about mental health.
Yay. All right.
Thank you so much for joining us for this episode of Leaning Into Therapy. If you'd like to follow along, you can catch our other episodes. You can also find more information about us as a practice at kdholmeslpc.com. Hope to see you soon.